All right, guys, welcome back to Underground Science. In this video, we'll be talking about protein C deficiency. Okay, so let's go and get started. So, of course, protein C deficiency, right? The name gives it away. You're deficient in protein C. Okay, you don't have enough of protein C. But to know why that's bad, we need to know what protein C even is and what's its normal function. Okay, so if we look at this diagram here that we have drawn, right? Protein C, okay, is a protein, right, that is made by your liver. Okay, so let's go ahead and say that. So first of all, it's important to know your liver, right, in terms of clotting. How does it help? It makes factors 2, 7, 9, 10, protein C, and protein S. Okay, so protein C is made by your liver, and its cofactor is protein S. Okay, so protein S is bound to protein C and it acts as a cofactor. So you need protein S for protein C to function. Now, we're familiar with thrombin, right, which is factor 2. In the normal clotting cascade, we know thrombin not only activates and aggregates platelets, right, so it can stimulate the activity of platelets and platelet aggregation, it also converts fibrinogen to fibrin so that you can stabilize clots, right? But when thrombin binds onto a certain protein present on your endothelium, so this is your endothelial lining here. On your endothelial lining, you have something called thrombomodulin. It's a protein. When thrombin binds onto thrombomodulin, thrombin's function changes. Okay? Normally, thrombin is involved in the coagulation cascade. When it binds to thrombomodulin, its function changes. How does it change? Thrombin, when bound to thrombomodulin, will then stimulate and activate protein C. And if you have activated protein C, what does activated protein C do? It inhibits, right? So this is our protein C, protein S, right? Complex, because protein S is a cofactor. So once protein C gets activated by thrombin, who's bound to thrombomodulin, protein C, the activated form, can inactivate factor 8 and inactivates factor 5. So if you do that, right, then you become anticoagulant. So you become antithrombotic. So protein C is an anticoagulant, right? Because it inhibits your clotting factors like factor 5 and factor 8. So now that that's understood, let's look at the findings and the clinical features. So if you're deficient in protein C, right? So let's talk about that here. If you're deficient in protein C, then you can't inhibit. So usually what does protein C do, right? It stimulates, or it inhibits, right? So usually what does protein C do, right? It inhibits factors 5 and 8. But if you're deficient in protein C, as you see in protein C deficiency, you can no longer inhibit factors 5 and 8, okay? So then you increase the risk of thrombosis because factors 5 and factor 8 are clotting factors, okay? So, but where though, right? So this is mostly seen as venous thromboses, okay? So due to protein C deficiency, you can get increased deep vein thromboses, right? You can get clots in your hepatic vein, right? Your cerebral veins, your legs, right? So like in your veins in your legs that can lead to if those clots dislodge, right, or break off from your endothelial lining, that can go to your heart and then get pumped into your lungs, maybe cause a pulmonary embolism, right? And then, of course, you can also get clots in your mesenteric veins, right? Remember, your mesenteric veins drain blood from your intestines. Now, a really important concept to know is warfarin-induced skin necrosis. Usually, when you give warfarin, and it inhibits vitamin K epoxide reductase, right? And we know that protein C has the shorter half-life when compared to factors 2, 7, 9, and 10. So remember, your liver makes factors 2, 7, 9, 10, and then protein C and S. We know that protein C has a shorter half-life when compared to factors 2, 7, 9, and 10. So when you give warfarin, right? Remember, your liver makes factors 2, 7, 9, 10, and CNS, but it needs vitamin K, specifically the reduced form, to do this, right? To even make these. And the way you get the reduced form of vitamin K is via the enzyme vitamin K epoxide reductase, right? Which reduces vitamin K. Then your liver can use that vitamin K to synthesize these clotting factors. Okay, but warfarin, okay, let's change the color. Warfarin inhibits vitamin K epoxide reductase. Okay, so if you inhibit vitamin K epoxide reductase, your liver can't use functional vitamin K to make these clotting factors. Now, we said protein C already has a shorter half-life when compared to these clotting factors. On top of that, if you give warfarin, right, you you inhibit the synthesis of 2, 7, 9, and 10 and CNS. So you deplete protein C even more. So not only does protein C have a shorter half-life, right? So it already depletes faster than your clotting factors. If you give warfarin, you deplete protein C further, okay? And if you deplete protein C further, then you have excess levels of factors 2, 7, 9, and 10, right? Which puts you at a prothrombotic state, which can lead to necrosis of your skin, right? That's what's called warfarin-induced skin necrosis, okay? So so that's that. Okay, that's important to know because for a certain time frame, right? You're in a prothrombotic state, okay? Because you get depletion of protein C faster than you do get depletion of 2, 7, 9, and 10. So then for a certain time frame, you're prothrombotic, but then after a while, right, then you do get depletion of factors 2, 7, 9, and 10 because that's what warfarin does, right? It depletes factors 2, 7, 9, and 10 and CNS, but protein C gets depleted faster because it has a shorter half-life than factors 2, 7, 9, and 10. So for a moment there, you have more clotting factors than you do have protein C, so you're prothrombotic. Okay, that can increase your risk of warfarin-induced skin necrosis. All right, so that's important concept when talking about protein C deficiency. Now, in terms of treatment, right? In terms of treatment, we can give fresh frozen plasma. Okay, so fresh frozen plasma, right, has clotting factors. Okay, so if there's a certain condition like where you're consuming your clotting factors at an excessive rate, or if you give too much warfarin, which means you inhibit factors 2, 7, 9, and 10, right, and protein C, then you can give fresh frozen plasma, which contains clotting factors like factors 2, 5, 7, 9, 10, 11, 12, and fresh frozen plasma contains protein C. So you replenish protein C and protein S, right, via fresh frozen plasma. Now, if you give too much warfarin, remember warfarin inhibits vitamin K, right? So then if you give vitamin K in a warfarin in a warfarin overdose, that's a consideration, okay? Because that's what warfarin inhibits. If you give more vitamin K, then you may have more functional vitamin K in order to make clotting factors, okay? Because vitamin K is inhibited by warfarin, all right? So of course, if you have warfarin-induced skin necrosis, you want to stop warfarin, and you want to give heparin if anticoagulation is still needed. All right. So so we should talk about the heparin bridge, right? Because we're talking about warfarin-induced skin necrosis, right? So what is the heparin bridge? So real quickly, right? In high risk patients, right? Meaning patients that are high risk of forming clots. Okay, so like what? Like what types of patients, right? If you're in general, right? If you're deficient in protein C or protein S, or if a patient has a mechanical heart valve, right? That's a high thrombosis risk, or AFib, right? That's a high thrombosis risk, as we know, right? So in patients with a high thrombosis risk, right? The heparin bridge can be considered. So what is the heparin bridge? So remember we said giving warfarin, right? What does that do? that leads to the inhibition of factors 2, 7, 9, 10, C, and S. We said that protein C has a short half-life when compared to factor 2, for example. Okay, so actually factor 7, right, has a shorter half-life than protein C, but when we're talking about factor 2, okay, and in general, right, these clotting factors, when you compare it to the half-life of protein C has a shorter half-life. So what does that mean? So when you give warfarin, you deplete protein C faster than you deplete your clotting factors, right? Especially when we're focused on factor 2, because factor 2 has a very long half-life when compared to protein C. So if you're depleting your anticoagulants, which is what protein C and S are, faster than your procoagulants, then for a moment there, you're going to be prothrombotic, right? So what you would want to do is start heparin and warfarin at the same time. If you give heparin and warfarin, right, then at the same time, right? So warfarin now, because of you giving warfarin, you're depleting protein C faster than you are your clotting factors, like factor 2, for example. So you're prothrombotic. But if you give heparin, we know heparin stimulates antithrombin 3, which inhibits factors 2 and 10, right? Factors 2 and 10. So you're giving warfarin, you're prothrombotic, but if you give heparin, you're inhibiting your clotting factors like factors 2 and 10, and then you would give both of those until warfarin starts depleting your clotting factors also. Okay. So once warfarin, if you give it enough time, warfarin will start depleting your clotting factors. Then you can take heparin off, right? And then you can stop heparin and continue warfarin alone. Okay. But in the beginning, for the first few days, when warfarin depletes protein C faster than your clotting factors, you should give heparin also. Okay. Because heparin can help inhibit your clotting factors for that first few days until warfarin is prothrombotic, right? But then once warfarin comes into full effect and successfully depletes your clotting factors also, then you can take heparin off, right? Stop heparin, right? Discontinue heparin, and then continue warfarin alone. Okay. So that's the heparin bridge. All right. So, and then that's basically it, right? That's protein C deficiency. And I hope this video was a little bit helpful. Hopefully it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.